In the vast expanse of human diversity, there lies a condition often shrouded in mystery and misconceptions. Autism Spectrum Disorder, or autism. It's a term that evokes varied reactions from concern and misunderstanding to curiosity and support. But beyond the myths and the hearsay, what truly lies at the heart of autism? Autism is not defined by a single story, but a multitude of experiences, challenges, and triumphs. It's a neurological and developmental disorder that affects how people perceive the world and interact with others. From the way we communicate to how we experience our surroundings, autism touches every aspect of life for those on the spectrum and their families. Yet, amidst the challenges, there's a wealth of strength, creativity, and potential. In this video, we embark on a journey to break down the barriers of myths and explore the real causes of autism. Through understanding and compassion, we can transform how society views and supports individuals with autism, celebrating the diversity and resilience that define the human spirit. Welcome to Cause Effect Channel. Join us as we look into the science, the myths, and discover the reality of autism. Because understanding is the first step towards acceptance, and acceptance opens the door to a world of possibilities for everyone on the autism spectrum. Autism spectrum disorder, as its name implies, encompasses a wide range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and non-verbal communication. But let's not forget it also includes a constellation of strengths and unique abilities. The spectrum of ASD highlights the vast continuum of differences in how people with autism can think, learn, and relate to others. From the quiet child who prefers solitary play to the adult with an uncanny attention to detail, autism spectrum disorder is as varied as the people it touches. But what is the history behind this diagnosis? The term autism was first used in the early 20th century, initially to describe a subset of symptoms in schizophrenia. It wasn't until the mid-20th century that autism began to be understood and recognized as a distinct condition. Over the years, our understanding of autism has evolved dramatically, leading to its current designation as a spectrum disorder. But despite this progress, misconceptions and myths about ASD continue to persist. Some believe that all individuals with autism are alike, while others attribute the condition to factors that have been scientifically debunked. We aim to explore these misconceptions, to shed light on the causes of autism, and to celebrate the unique strengths and potential of those on the spectrum. So, let's journey together into the world of ASD, breaking down myths and building understanding. Because the more we understand about this diverse condition, the better equipped we'll be to foster acceptance, support, and empowerment for those living with autism spectrum disorder. What really causes autism spectrum disorder? Is it a single factor, or is it more complex than that? Let's delve into the intricate world of ASD causality, where we find an interplay of genetics, environment, and neurology. Firstly, genetics plays a significant role. Studies have shown that if one identical twin is diagnosed with autism, the other is likely to be diagnosed as well. This suggests a strong genetic component. However, it's not just one gene that's responsible. Researchers have identified numerous genes that, when combined in certain ways, can increase the risk of autism. Then we have environmental factors. These are not about the surroundings we grow up in, but rather the conditions in the womb. Factors such as prenatal exposure to certain drugs or chemicals, complications during birth, or the mother's health during pregnancy can all play a part. Though these factors don't cause autism by themselves, they can interact with genetic vulnerabilities to increase the risk. Neurological aspects are also crucial. In people with autism, the brain develops differently, particularly in areas responsible for social interaction and communication. This doesn't mean that their brains are flawed, just different. And this difference brings a unique perspective on the world, which can often lead to exceptional talents and abilities. Now let's address the elephant in the room: vaccinations. Despite widespread misconceptions, numerous robust studies have confirmed that vaccines do not cause autism. The myth started with a study published in the late 90s, but it's been thoroughly debunked. The real danger lies not in vaccines, but in the diseases they prevent. The causes of autism spectrum disorder are indeed complex, involving a combination of genetic, environmental and neurological factors. It's a rich blend of influences, each thread important but none solely responsible. And while we strive to understand these causes better, let's remember that people with autism are not broken or damaged. They are unique individuals with their own strengths and challenges, just like the rest of us. The causes of ASD are complex and multifaceted, and certainly not caused by vaccinations. As we continue this journey, let's celebrate the diversity within the autism community and strive for a better understanding of this fascinating disorder. Did you know that individuals with autism spectrum disorder often possess unique strengths and talents? Let's celebrate these strengths. Imagine a world where attention to detail is second to none, where patterns are seen where others see chaos, or where memory can be as precise as a well-tuned instrument. These are just some of the strengths often associated with ASD. Take Temple Grandin, for instance, whose unique perspective revolutionized the livestock industry with her innovative designs, drawing from her unique sensory experiences. Or consider Daniel Tammet, a writer and autistic savant with extraordinary mathematical and linguistic talents. Known for his ability to perform complex calculations in his head and for learning new languages with remarkable speed, Tammet's story is a testament to the unique ways in which the autistic mind can perceive and interact with the world. These individuals remind us that ASD isn't defined by limitations, but rather it's a different way of experiencing the world. It's important to remember that while ASD comes with its share of challenges, it also brings forth a wealth of unique strengths and gifts. ASD is not just about challenges, it's also about unique strengths and talents. Living with ASD often means navigating a world that doesn't fully understand you. It's like trying to decode a language without a key, where the social norms, communication cues and expected behaviors often seem to be written in invisible ink. Individuals on the autism spectrum often face challenges in three key areas: social interactions, communication, and behavior. In the realm of social interactions, understanding and interpreting nonverbal cues can be a complex puzzle. For some, it might feel like everyone else has a script for social situations that they were never given. Communication, too, can present its own set of hurdles. Some people with ASD might have a rich vocabulary and an impressive command over language, but struggle with the back-and-forth rhythm of a conversation. Others might find it challenging to use or understand non-literal language like idioms, humor, or sarcasm. Behaviorally, people on the spectrum might engage in repetitive behaviors or have intense, focused interests. They may also have a strong preference for routine and predictability, and changes could be quite distressing. Now, imagine being in a bustling supermarket where the fluorescent lights are glaring, the music is blaring, and the checkout counter is a cacophony of beeps. For many of us, this is just a regular shopping trip. But for someone with sensory processing issues, often associated with ASD, this could be an overwhelming barrage of sensory stimuli. It's not that they're overreacting, rather they're experiencing the world more intensely than others. Understanding these challenges is not about labeling or pigeonholing individuals with ASD. It's about gaining insight into their experience of the world. This knowledge is a tool, a bridge that can help us connect and communicate more effectively. It allows us to be more empathetic, patient, and supportive. In the end, understanding these challenges is the first step toward creating a more inclusive society. It's about recognizing and respecting the diverse ways in which we all experience the world. And it's about creating environments where everyone, regardless of where they fall on the spectrum, can feel understood, accepted, and valued. Managing ASD is all about understanding and addressing individual needs. It's a journey of discovery, adaptation, and growth, both for the individual with autism and their support network. Let's start with early intervention. Recognizing signs of autism at a young age can lead to more effective management strategies. Early intervention can help children develop essential skills, such as social interaction and communication, through structured play-based therapies. Next on our list are behavioral therapies like applied behavior analysis, ABA, and cognitive behavioral therapy, CBT. These therapies can help in developing positive behaviors and reducing those that are harmful or affect learning. ABA focuses on rewarding positive behavior, while CBT helps individuals to understand and manage their thoughts and emotions. Educational strategies also play a vital role in managing ASD. Special education programs tailored to the individual's needs can help them thrive academically. These programs often incorporate visual aids and structured routines, providing a supportive and predictable learning environment. Communication therapies are another essential component. Techniques such as speech therapy, picture exchange communication systems, or even sign language can be invaluable in helping individuals with ASD to express themselves. Sensory integration therapy can help manage sensory processing issues, which are common in autism. This therapy often involves occupational therapists who create personalized activities to help individuals respond better to sensory stimuli. Medication is sometimes used to manage co-occurring conditions, such as ADHD or anxiety, not to treat autism itself. Always consult a healthcare provider for advice tailored to individual needs. Support for families cannot be overstated. Parent training, respite care and support groups can provide invaluable resources and emotional support to families navigating the complex world of autism. Lastly, transition services for adults with ASD are crucial in helping them lead independent, fulfilling lives. These services may include vocational training, life skills education, and support in finding suitable housing and employment. With the right strategies and support, individuals with ASD can thrive. Remember, every person with autism is unique, and so too should be their management strategy. It's about finding the right balance, the right tools, and the right support to help them shine in their own unique way. How can we support individuals with ASD and contribute to a more inclusive society? That's a question we must all ask ourselves. Advocacy, awareness, and inclusive policies play a crucial role in reshaping the narrative around autism spectrum disorder. Advocacy isn't just about raising our voices for those on the spectrum. It's about educating ourselves, understanding their unique experiences, and championing their rights for equal opportunities. Awareness is about dispelling myths and misconceptions, fostering an environment of acceptance and empathy. Inclusive policies, be it in schools, workplaces or communities, are the bedrock of a society that values diversity. These policies ensure that individuals with ASD are not just included, but they are also valued, respected and supported. Every small action, every conversation, every policy change contributes to a more accepting and inclusive world. Remember, understanding, acceptance and support can make all the difference. Let's be the change we want to see. Together we can create a world where everyone, including those on the autism spectrum, feels valued and included. Before we move ahead, let's take a moment to reflect on what we've learned about autism spectrum disorder. ASD is a spectrum encompassing a wide range of conditions, each unique and diverse. The causes of ASD are complex and multifaceted. It's important to understand that vaccinations do not cause autism. Instead, a combination of genetic and environmental factors plays a role. Individuals with ASD often possess unique strengths and talents, demonstrating exceptional skills in areas like art, music, or academics. Understanding the challenges faced by individuals with ASD is crucial for creating a more inclusive society. Effective management strategies for ASD are not one-size-fits-all. They are about understanding and addressing individual needs, promoting personal growth and autonomy. Advocacy, awareness, and inclusive policies are key to supporting individuals with ASD. They help reshape societal attitudes, foster acceptance, and ensure equal opportunities for all. With understanding, acceptance, and support, we can all contribute to a more inclusive society for individuals with ASD. Let's keep these insights in mind as we continue to learn, grow, and advocate for those on the autism spectrum. Thank you for joining us on this journey of understanding autism spectrum disorder. If you found the information in this video helpful, we urge you to take a step further. Subscribe to our channel for more enlightening content and become part of a community that values knowledge and understanding. Spread the word by sharing this video with friends, family, and loved ones. The more we know, the better we can support those on the spectrum. Remember, awareness is the first step towards acceptance. Together, we can make a difference. Stay informed, stay supportive, and stay tuned for more.